Hello there, I'm Dr. Duncan Wheatley. I'm a clinical oncologist in breast cancer and I work at the Royal Cornwall Hospital. And I'm going to explain to you why we might recommend radiotherapy or chemotherapy to you after or before your surgery for early breast cancer. When we treat breast cancer, we treat it on an individual basis. So we're going to look at all of the factors, including what you're like, what other illnesses you have and your wishes. And also, we're going to look at all of your tumour features because no two breast cancers are the same. So we look at different features of your breast cancer to decide whether it was a nasty one that might need lots of treatment or a not very nasty one that might need very little treatment. Okay. We sometimes give radiotherapy when we've cut out your breast cancer. When you cut out a breast cancer, you hope that the surgeon has cut it all out. But cancers do spread around the breast or around the body, and the aim of this treatment is to kill off the remaining bit that's left behind. With radiotherapy, this is high-powered X-rays that we shine through your breast, and we hope that by doing that, any little tiny bits of cancer left behind will be killed off by the treatment. To have radiotherapy is very painless. You simply lie down flat on a couch, and we'll show you that later, and you lie there for a few minutes each day, and when you're having the treatment you won't feel anything at all. It won't hurt, you won't feel sick or anything like that. When you're having the treatment we'll all leave the room, but we'll all be able to see you and hear you when you're having your treatment, and there's nothing to be scared of. The machine will be a long way away from you and it won't hit you or hurt you. During each treatment, as I said, you'll feel nothing, but as the treatment goes on, your skin may get a bit red and inflamed, a bit like a sunburn, and some people get very little reaction, and others do get a brisk skin reaction, such as a sunburn, but this will fade with time once the treatment's finished. Some people get long-term effects of radiotherapy. These can include some tenderness in the breast, or some slight shrinkage of your breast tissue, or some slight discoloration of your skin over your breast. Very, very rarely some lung damage occurs, but this is extremely rare and not something I remember seeing in living memory. We make sure we avoid bits like your heart underneath, so the risks of long-term damage to other areas is extremely small. The reason we're giving radiotherapy, as I said, is to reduce the chance of the cancer surviving, and if you have a course of radiotherapy, you're about 3 or 4 times less likely that your cancer's ever going to grow back in your breast than if you don't have radiotherapy. So for nearly everyone we recommend it, but it will be down to you finally to decide if it's for you or not. When we give radiotherapy, we split the treatments up into several little doses rather than giving it in one dose in one big go, and there's a variety of ways we can do that. The normal treatment is that we give 15 treatments Monday to Friday for 3 weeks, and that gives a sensible dose of radiotherapy to kill the cancer and a very tolerable dose to your skin. For some people we also give a week and a half's radiotherapy extra, another 5 to 8 doses after the full breast radiotherapy, just to try and kill any remaining little cells where the tumour started. But we don't always give this. We also do many studies with breast cancer radiotherapy. Sometimes we're looking to give less doses to reduce the bad we give by radiotherapy but to keep the good, and sometimes we give higher doses to people with nastier tumours who we're worried that their cancer will still grow back despite the normal treatment. All these options will be discussed with you when you come to receive your radiotherapy, if they're relevant to you. Now this is the radiotherapy machine, or as we call it, a linear accelerator. And this machine actually delivers the radiotherapy that you're going to have. As you can see, this is a big room. You're not in an enclosed space. You're not tied down or held down. You're simply in the same position that you were when you had your scan to aid your radiotherapy. And you'll lie down here, Your head will be here and your arms will be out the way, held by this, rested on this position here. Now the radiotherapy actually comes out of the head of this machine. You can't see it or feel it. If it was on or off you wouldn't know. This machine can spin around this way, and it can also spin around lots of different ways. So when you're lying down, the girls and boys in here aiming your treatment will be shouting out lots of numbers to make sure your radiotherapy is delivered exactly in the way that's been planned for you. So this machine will turn around and spin, but it won't touch you or go near you. It'll be nearly a metre away from you, and then the X-rays will shine through you from afar. So once you're all set up, then they'll ask you to stay still, and then when the machine's in the right position, everyone will leave the room, but we'll be able to see you and hear you when you're having radiotherapy, as behind us there's another camera and a microphone, so you can talk to us or we can talk to you and see what's going on. And when you're having the treatment, the machine will only be on for a few minutes at the most, and you just have to lie still. We can tell if you're moving and see if you're moving, so the machine can be turned off if there's a problem, which there rarely is. So the machine will deliver the radiotherapy from one side, and then without you moving, the machine will turn around and treat you from the other side, and the X-rays will shine through your breast, or if we're treating your lymph glands, through your lymph glands from the other side. Again, the treatment will just take a minute or two again. You won't feel anything at all when you're having it. You won't hurt, won't make you feel sick, won't do anything at all. The reaction you get to the radiotherapy happens as you go through the course of treatment, which, as we mentioned before, might cause some skin redness and might make you a bit tired, but you won't normally be unwell by this treatment. You may be treated on a different machine from this, but all the machines do the same thing. None of them touch you, none of them hurt, and none of them come anywhere near you. So hopefully seeing this will make you a less fearful thing to go through. And I promise you we are all very nice, and everyone will look after you as carefully as we possibly can.
My name is Liz. I'm one of the radiographers here at the Sunrise Centre, and when you first come to meet us, you'll meet either me or one of my colleagues to talk about your radiotherapy. After your initial consultation with the oncologist, you'll be referred here for us to plan your radiotherapy. Your initial appointment will be with a radiographer when you come to have your planning scan for your treatment. We will sit and chat with you about the side effects of treatment, what to expect as you go through treatment, and what to expect from your CT scan. This will take approximately half an hour, and at the end of this you will usually sign a consent form when you agree to have the radiotherapy treatment. In order to plan your radiotherapy treatment accurately, we need a CT scan. This is performed here in the department. It takes about 10 minutes. For the scan you need to lie still in the radiotherapy treatment position. The radiographers will then explain what happens to you. They will line you up with some lights in the room, and then you will have a short scan. After you've had your scan, we will make some little tattoo marks on your skin. These are very small tattoos. They are permanent, but you probably won't notice them. They're very important for the radiotherapy to be accurate when you come back to start your treatment. The CT scan that you have here is just for us to plan your treatment, and you won't need to wait for any results from it. We will talk about the side effects that you might expect from your radiotherapy at this point, but we will give you a leaflet so that you can take it away and have a read. This leaflet will also explain how to look after the side effects you may experience, but we will talk about these with you at the time. When we have your scan, there is a lot of background work that needs to be done before we can give you your treatment. This is called the planning process and normally takes 3 to 4 weeks. This takes this amount of time because it's a complex process involving your consultant and 3 or 4 other people. When the plan is checked and ready to go, we will be informing you of your appointment date. Radiotherapy is a very simple treatment. It involves you lying still on a hard couch for probably about 10 minutes. Most of this is the time that it takes us to set you up for your treatment. The actual treatment time will probably only be 1 or 2 of those minutes. The radiotherapy machine doesn't actually touch you, and when you have the treatment you don't feel or see anything at all. Radiotherapy for breast cancer is normally given in 3 weeks. This means coming to the department every day for 15 treatments. This may vary according to your own personal circumstances. On your first visit, you will probably be in the department for around half an hour. The treatment that you have on the first day takes a little bit longer for us because we need to check all the parameters that we have planned to ensure that there are no changes to your body shape. We also take an X-ray on this appointment to check that we are happy with everything involving the treatment. Subsequent visits normally take about 10 minutes. You will see me once a week for an appointment to have a look at your skin and check any side effects that you're having, and also to talk about any concerns that you may have. Normally our appointment system works well here and you will be seen at the time that you've been given, but occasionally we do have problems during the day and this might hold us up a little bit. We will always inform you if there's a problem.
When it came to radiotherapy, you go to the Sunrise Centre to have a CAT scan to put markers on you, so you're measured for your radiotherapy to make sure that the dose is very specific for where they want it to be. They tattoo these markers, which is very, very tiny. I can't even see my markers anymore. And then once they've done all that, your radiotherapy can begin. You have, or I had, most people do, 3 weeks of 5 sessions. It only takes about a minute to actually receive the radiotherapy. It takes more time to actually get your body lined up on the machine than it does to actually have the radiotherapy itself. There was no discomfort receiving the radiotherapy, and you just sort of got dressed and off you went. My breast tended to be warm at the end of after about a week of radiotherapy, the effects began to show. But all it was I felt as though I'd got a warm breast in comparison to the other one. The nurse was very sweet and she told me to put a white cabbage on my breast and to help it soothe it, and it actually worked. I was amazed. So something very natural, very nice, but quite weird, I suppose, to have next to your skin. So by the end of the 3 weeks, you walk out and you feel free, and you've finished your treatments and you can move on. There's no more regular hospital appointments to turn up to every other week, and you feel as though life gets back to normal after that point, which is great. You receive your appointments for the radiotherapy, and it's a set time every day, generally the same time of day, so it's a regular thing. The appointments are like clockwork. You are in and out of there within 10 minutes of actually walking in. You are back out of the doors of the Sunrise Centre again. It works really efficiently. So the rest of the day is yours. So whether you then go into Truro, have coffee, you can do anything else for the rest of your day. You're free. And at the end of the whole of the radiotherapy, it's all finished and you move on.